The holidays, and everyone's going to gather for those family pictures that you cherish so much, and someone in the family, perhaps it's you, might say, oh, you know, I'm going to pass, or they're afraid to smile, and there's a reason, because they have ill-fitting dentures, or they're just not comfortable with their smile. Freedom Mini Dental Implants do just what they say they do. That's the freedom to feel good and confident about your smile. Dr. Regan Ackerman joins me once again. And Dr. Ackerman, I know for a lot of people it's enjoying the foods they love because their dentures don't fit right, so they're not able to eat what they love. But I think that confidence factor means something too, doesn't it?
Oh, for sure. You know, functionality is always number one, being able to eat the foods you want to eat. But like you said, the confidence to be able to smile in those pictures or out socializing is, you know, beyond, not to know that your denture is not going to fall out and you don't have to use denture glue, and have that self-conscious, you know, about your smile, definitely is very important. So,
yeah, there may be people watching who are saying, okay, I've heard about surgical implants and I'm familiar with that, but this is different. Number one, at least to me, because I'm on a pretty tight budget, is that it's less costly, a lot less costly than the old method. Secondly, it's less invasive. I mean, there's no stitches, there's no healing, there's no... I don't think there's really a downside. They're just as durable, they're just as dependable. This is just technology you may not be aware of. Talk a little bit about the difference between the old method, Doctor.
Yeah, certainly. So the mini dental implant, it's a titanium implant, just like the surgical ones, the same material. It is just a smaller diameter implant, which makes it a lot less invasive, like you said. No stitches, no incisions. I don't have to put people to sleep to place these. And like you said, the healing time is minimal. A lot of times with the Snap-In Denture, I know we'll show later, the day I put the implants in, the patient, they leave with that denture snapped onto the implants that day. There's no more waiting 3 to 6 months until you can use that implant. So these, and like you said, the mini implants, the technology has been around for 15, 20 years. But a lot of people don't know about it, especially if you've had dentures for 10 or 20 years. You haven't been to the dentist, and you don't know that this option is out there. And like you said, it definitely is a lot less costly, less invasive than the surgical implants.
Man, what a great gift to give to yourself or a loved one, to throw away your dentures and not have to mess with that glue any longer. And if you've seen Dr. Ackerman on previously, you may remember there were 2 methods. Now there's actually 3. There's 2 very distinctly different methods, and then there's kind of a hybrid of the 2. So talk a little bit about the 3 things that you do.
Yep, yeah. So number one thing we do is a Snap-In Denture, which gets people out of using denture glue. When that denture's flopping around and moving, the Snap-In Denture just, you know, keeps the denture in, okay? The other thing we do is the permanent teeth. So that gets you out of a denture completely.
No plastic, nothing.
Nothing on the roof of your mouth anymore. You get to taste your food, chew and eat all the things you want to eat again. And then, like you said, you mentioned the hybrid, which is very similar to the permanent teeth. They still just snap in and use those attachments. But as far as cost goes, it just gives people another, you know, middle of the road option to fit in their budget.
All right, yeah, and it is very budget friendly. If you have a question, 571-5263. Dr. Ackerman will be glad to field the calls, because a lot of people get very excited, and rightfully so, about this, because they've heard about surgical implants. Maybe, like you said, maybe 15, 20 years ago they went to the dentist and he said, wow, either you're not a candidate or perhaps it was too costly for you. The times, they are a-changing, and it's for the good. Dr. Ackerman, as I said before, when you come on here, I researched your company, I researched what you do, and I really don't see a downside. For people who are saying, well, do I have to go see her every 2 or 3 months? You don't see your patients much after you put them in, do you?
No, we don't. So, and it's a good thing, though.
Yeah,
I always tell them, I said, you've graduated from us.
Graduated.
Yeah, so, but you know, usually, you know, you get these and you no longer have to use denture glue, no adjustments, you know, it's just, it's nice. And like also what you mentioned, as far as a lot of people were told they weren't candidates for the surgical implants, with the mini implant, I do not have to have as much bone. So no bone grafting, no sinus lifts. People with medical conditions, I don't have to take you off blood thinners. You know, there's just a lot of extra things with these mini implants that, because they're so less invasive.
All right, again, if you have a question, Dr. Ackerman, 571-5263. All right, everyone loves a beautiful smile, right? So let's introduce Audrey. This is one of your patients, right?
Yeah. Audrey, a wonderful person, came to me, you know, struggling, had to have her teeth out. I think she had dentures and was just miserable, couldn't keep them in. So we did the Snap-In Denture for her. When she came to me, she was like, I'm on a diet of soup and yogurt, and I hate it.
Oh.
And so we did the Snap-In Denture for her, and her big thing was eating pretzels. And so when she came back, she was like, I can eat my pretzels again. And she was so excited. And as you can see, I mean, just her smile, it lights up a room, and she deserves to have that smile.
And it erased 20 years from her face, because that is a very natural, genuine, sincere smile. It's beautiful, Audrey. Yeah, you have a beautiful smile. And let's talk a little bit about that, because the holidays are here. You know, we've talked to people who have called you and said, you know, I don't like getting in pictures. And you probably hear it all the time. I've seen people who, when they talk, they cover their mouth.
Yes.
Or I've watched them also look at a menu, and you can tell they want to order something, but they order the soup.
Yes.
So talk a little bit about that, if you will.
Yeah, I mean, it's life-changing. Like you said, I think one of the biggest things is people now can say, I can go to a restaurant and I can order whatever I want on the menu. I don't have to be limited. And, you know, a lot of people, too, when I'm taking those before pictures, I'm like, smile, and they're like, I don't know how to smile. I forgot how to smile.
That's sad.
It is. And so, and then we take those, you know, and it just, their new smile lights up the world, you know, and they see it. Their family members, even sometimes when they come back, they say, my family members say I'm so much happier and nicer because they're just smiling now, you know, and they were happy before, but they just couldn't show it with their smile because they were embarrassed. So
coming up in the next segment, this is good stuff here, but in the next segment we'll show you exactly, she's got some models here, and we'll show you exactly how the procedure works. But also, perhaps you have a loved one, and maybe they're younger, and maybe just missing a teeth. Maybe it was a genetic defect, and they're not comfortable with their smile. So if it's 1, 2 teeth, perhaps it's your chewers in the back, you can take care of those as well, right?
Certainly, yep. We can do 1 tooth, get rid of a partial, get rid of flippers, like you mentioned. You know, there's some teenagers or, you know, people in their young 20s that were born without some permanent teeth, and they're wearing retainers, and they're miserable, and we can get them out of those as well.
Wow, that's a great Christmas gift.
Yes.
To enjoy the foods that you love, to feel confident about your smile. There's so much trickle-down effect from that. You know, the positivity of life, and being able to jump in those family pictures and be enthusiastic about going out and eating and grabbing yourself a nice chewy steak or some good crisp vegetables. And if you have a question for Dr. Ackerman, 571-5263 is the number. It's Freedom Mini Dental Implants, and I want to stress this often because I think it's important. The consultation is free. Yes. If you think you're a candidate or a loved one is a candidate for these implants, it's free, right, Doc?
Yes. All you do is call, set up a consultation. It's no charge for the consultation. And a lot of times I'll take an x-ray, even a 3D x-ray, to confirm that you're a candidate and have enough bone. It's pretty rare that I have to tell somebody they're not a candidate. I'd say 98% of the people that walk in the office, I can tell them they're a candidate for the mini dental implant. So please call, set up the consultation. Like we said, it's no charge. We're right across from Valley High School, and it's, you know, worth the drive to come and let me take a look and see if I can help you out.
Yes, indeed, and much less expensive. We'll talk about all the advantages, and we'll field some phone calls as well. Again, I'll remind you the number 571-5263 if you think you might be a candidate. We'd love to hear from you. Freedom Mini Dental Implants.
After Clarence was badly injured in a car crash, attorney Richard Breen protected his rights.
I've dealt with all kind of lawyers and all kind of lawyer firms, but Mr. Breen was the best I've ever had.
I'm Richard Breen. If you've been injured, give us a call.
In the mornings, kickstart your day by doing breakfast the King's way. And enjoy a breakfast value deal without shortcuts. Now you can eat breakfast like a king. Start your day like a king with a 2 for $4 breakfast deal at Burger King. Now with cold brew and French toast sticks.
If you're on Medicare, remember, the annual enrollment period is here. The time to choose your coverage ends December 7th. So talk to United Healthcare and take advantage of a wide choice of plans, including an AARP Medicare Advantage plan from United Healthcare. It can combine your hospital and doctor coverage with prescription drug coverage and more, all for a low monthly premium, or in some areas, no plan premium at all. Take advantage of $0 copays on all primary care doctor visits, all virtual visits, and preventive dental care. Plus $0 copays on hundreds of prescriptions. And with Renew Active, enjoy a free gym membership. So call United Healthcare and take advantage of the range of plans we offer. including PPO plans that let you see any doctor who accepts Medicare without a referral. Enrollment ends December 7th. Call United Healthcare or go online today.
This year, there are more ways to help Kentuckiana's children in need have a brighter holiday. Donate to the Wave 3 New Salvation Army Angel Tree program by dropping off new unwrapped toys at Arby's restaurants. Go to wave3.com for more information.
After Clarence was badly injured in a car crash, attorney Richard Breen protected his rights.
I've dealt with all kind of lawyers and all kind of lawyer firms, but Mr. Bream is the best I've ever had.
I'm Richard Breen. If you've been injured, give us a call.
Freedom Mini Dental Implants. We're going to take a look at some of the models. So if you want to know exactly how does it work, how do they save you money, how is it less invasive, Dr. Ackerman, you can show them with these models. It's interesting to me because, you know, I would think usually advancements in technology, you pay more for them. But in this case, the advancements here, you pay less.
Right, exactly. So yeah, one of the most common things I do is what we call the Snap-In Denture. So when we place these implants, you know, I'm not making any incisions or stitches, okay? Just a little numbing, okay? And then, you know, place the implant, little titanium screw there, a lot less invasive than the big surgical ones. And when I place these implants, the same day, I am putting these attachments inside your denture, and then you leave with the denture snapped on to those implants.
Firmly.
Firmly, yes. No more denture glue, no more worrying about if your denture is going to flop out, and you're able to eat more, a lot more comfortable for the denture. And then you'll be able to snap it out once a day and rinse and clean it yourself. But like I said, minimally invasive, no incisions, no stitches. Definitely, if you're going to have a denture, this helps keep it in and get you out of all that yucky denture glue. I've even had patients with this option tell me they could still taste their food better because they didn't have all that glue in their mouth.
Okay, let's talk about the option that I love, which is your third set of teeth. No plastic, no denture, throw away the dentures. How does this work?
Yes, so same concept. We're going to place the implants the same way.
In your mouth, no plastic.
No stitches, right. We're just going to put more implants in, but with this option, we're able to make just a bridge of teeth. Okay, so no more plastic, nothing on the roof of your mouth, and these get cemented on to those implants permanently. So nothing comes in and out. Like you said, this is kind of like your third set of teeth. But then, as you can see, you have nothing on the roof of your mouth anymore. You get to taste your food again. You don't have any of that plastic. We give you a water pick. I kind of call it like a power washer for your mouth, and your job at home is just to keep it clean and brush it. But this is like having your teeth back again. It's the closest thing to getting your teeth back, where you can chew everything you want to chew and taste your food, not have all that bulky plastic in your mouth anymore.
All right. And Dr. Ackerman, now there is a third method, and this is relatively new. And I can understand you probably had clients who said, you know, I like a little bit of both. I have a budget here. This can help you,
Certainly,
right?
yes. And it's a great thing. So same way as far as placing the implants, the little small diameter mini implants, no incisions, no stitches. And so with this option, we still make a bridge of teeth, so you can see it's still not a denture. You don't have anything on the roof of your mouth. You lose a lot of that plastic, but we just still use the attachments inside the bridge, and then this gets snapped on, and then it stays in as well. You don't have to take this in and out every day either, but same advantage. You have nothing on the roof of your mouth. You get to taste your food again. No more plastic of the denture. It feels more like your natural teeth. And it's a great kind of middle-of-the-road option to get people, you know, in a budget that they're comfortable with.
All right. Great options there. And we'll show you a little bit of how it's less invasive in a second with another model. But we've asked for phone calls. Donna was nice enough to pick up her phone and call us. Donna, welcome in, and thank you for watching.
Hello. I was just calling to say that I had a tooth put in last week by her, and I just wanted everybody to know that I felt no pain.
Aww.
She is very clean, very thorough, and, you know, very COVID, you know, thorough. I mean, I waited in the car, and I just was very happy with the experience.
Thank you, Donna. I really appreciate that. And I had no idea she was calling.
Right.
Awesome. I really appreciate
I just saw her on the television, and I thought, you know, people need to know that, I mean, I had literally no pain. I felt nothing.
Thank you. And I appreciate you bringing up the COVID protocol, because that's very important too. We have a lot of, I mean, obviously it's something to be worried about right now, but we do. We really only have one patient in the office at a time. We've taken extra protocols. Donna probably knows we have a little extra suction device to catch aerosols. So we are doing everything in our part to keep our patients safe and to keep us safe as well. So that's a great point. Thank you.
It is a great point, because I think if you've been apprehensive and you've been procrastinating, now's the time. The holidays are coming, and this can happen very quickly for you, less expensive, and wouldn't it be nice to go into the holidays going, hey, not only am I going to jump in that picture, put me in the front. You know, not only am I going to take part in this holiday meal, I'm going to eat exactly what I want, and there's a lot of people who can't do that. So let's talk about why it is less invasive. See, I'm familiar with what you do here. All right, watch this. Well, I'm going to do
okay.
this.
All right, go. You go.
Dr. Ackerman, I'm going to play Dr. Ackerman here. I wish I had the education so I could actually do what you do, because I think it's fascinating. Okay, so if you look at this, let's put this on camera here. Okay, this is your jawbone here, okay? So this is a model of your jawbone. I'm playing Dr. Ackerman here, okay? And this big hole that you see, hopefully, we'll get a camera on this. The big hole that you see, yeah, there we go.
There we go.
Yeah, the big hole is the hole that is needed by the old method. Okay, the surgical method. They need all of that bone. So if you've been told you don't have enough bone, that's the reason, because they need a big hole. Now, with the new mini dental implants, if you can see it,
I you can't even see the hole on the camera.
Yeah, it's so little. It's right next to it. That's all she needs.
Yeah.
You only have to have just a fraction of the bone that was formerly needed. So look at me, Dr. Ackerman. I'm learning.
You're doing good.
See, I'm a good student.
Yes.
I wish I was this good a student when I was in school. Maybe I would be as accomplished as you are. But anyway, that's how it works. So if you're wondering, okay, you know, how come I'm now a candidate? There's your reason right there, right?
Right, certainly. You know, people have come to me that said they told me I needed major bone grafting or sinus lifts, and I wasn't a candidate for the surgical implants. And I've been able to take, you know, I take my 3D X-ray and confirm with them that they can be a candidate for these mini implants. And also just, you know, showing that model shows you how less invasive it is, and why Donna can call and say, you know, I had an implant placed and had no pain and everything went great, because that just, you know, shows you how minimally invasive it is.
I'm curious, what is the number one reason why people don't come to you, or when they get this done, obviously they say, I wish I'd have done it years ago, but what is it? Because A, they're afraid it's going to be a dental experience that's painful?
Yes.
Or is that the main one?
Yeah, main reason is
yes.
fear. Yeah. And I always tell people, it's funny because and Donna will know, you know, before I do anything, I kind of explain everything we're going to do, so there's no surprises, and let people know. And a lot of times after, you know, I'm like, okay, well, that was one implant in, and they're like, really? That an implant's in? I'm like, yeah. And you know, their mind had conjured up this you know, that it was going to be awful experience. And so once we, you know, if we're doing multiple implants, once we get one in, all of a sudden they're just like, okay, this is easy. You know, let's do this. So, but you're right, fear is a main one. You know, they've had a bad experience, you know, with a root canal or with a filling or a crown prep. And this is not your normal dental experience. It is not a ton of drilling all day long, you know, in your mouth. It's very, very minimal.
All right. If you have a question, 571-5263. We'll take a quick break. We'll load up the phone calls. Again, the name of the company and the consultation is free. Freedom Mini Dental Implants. We'll be right back.
In a wreck? I'm attorney Darryl Isaacs. If you've got questions, we've got answers.
What's the rush? Why do I need to call now?
The sooner you get in touch with us, the sooner we can file your claim. Start interviewing witnesses and investigate your case. And we'll fight to get you every dollar you deserve.
What if you don't win my case? Do I owe you money?
You don't owe us a dime unless we win or settle your case. That's the Isaacs and Isaacs guarantee, and you can take that to the bank.
Call 800-800-8888.
One call, that's all.
Something you don't know about the mom and dad who live next door. They hate having to buy new clothes, because every penny they spend is one less they can spend on food. Their pride won't let them ask you for help, but they might ask Dare to Care.
Dare to Care Food Bank. Help us feed your neighbor. Donate today.
It's a fact. 2 out of 3 Americans who qualify for Medicare do not receive all the benefits they deserve. You could be missing out. Now, Anthem Blue Cross and Blue Shield introduces a free Medicare plan checkup to make sure you receive all the benefits you qualify for in 2021. Call 1-800-668-0176 today. and receive extra benefits for a $0 monthly premium. Benefits like dental, vision, hearing, and prescription drugs. And to help you stay healthy at home, you can have free prescription drug delivery, online doctor visits 24/7, and free streaming exercise classes. You can even receive money towards over-the-counter health items. Call 1-800-668-0176 today and feel confident you have all the benefits you deserve for 2021. You can receive extra benefits for a $0 monthly premium, like dental, vision, hearing, and prescription drugs. Call 1-800-668-0176 and make sure you're not missing out.
Stability, functionality, that's all there for you, and a more confident smile with Freedom Mini Dental Implants. Dr. Regan Ackerman is with me, and we've opened up the phone lines because a lot of people have questions. It's like, I may be an exception. Am I a candidate? And Mike is one of those who was nice enough to give us a call. Mike, thanks for watching, and thanks for calling.
Yes, thank you for taking my call.
You have a question?
Yes, a couple of years ago I had my teeth pulled and was going for dentures, and as soon as they pulled all my teeth and they tried to slap the dentures in, I've still got part of a tooth left in my upper gums. And I had to put it off because I was going in for open heart surgery, so I had to wait. I didn't want to have teeth put in, not make the surgery, so I wanted to make sure that I didn't waste all that money on my teeth and not be able to come through it.
Sure.
Good.
And so I was wanting to see possibly about getting some implants. My wife went back to work. Her insurance is, we have a prepaid insurance card, and she'll have to use it up. So we're going to try to get this taken care of.
Yeah, certainly. So yeah, I would definitely invite you, please call and make the consultation, because it sounds like you've done majority of the hard work. You already had all your teeth taken out and you're healed up. I would have to take a look at that little broken, tooth or fragment and see what's going on there. See if you need, if we make new dentures, and see what your options are and go over cost. And that's one thing when you come in for the free consultation, I'll take the x-ray and we'll go over all the options for you, and you will know all the cost. I know you've got your insurance, and we do have financing plans as well. So definitely, it sounds like you would be a candidate and deserve to get a smile and a teeth, especially after going through open heart surgery. And now that it sounds like your heart is back in action and doing good, and let's get you smiling and eating again. So please call and make a consultation for sure.
Yeah, and for Mike, in that window of time between when he was thinking about getting those implants put in and now, perhaps the technology has changed, and you may save some money as well, significant money with Freedom Mini Dental Implants.
Instead of going the surgical route.
Exactly.
And because of his medical history with the heart condition, I mean, the mini implants are going to be a lot less invasive, and not major surgery like the surgical implants.
Yeah, let's talk about that. Folks may be on blood thinners. That doesn't exclude them, does it?
No, it doesn't. And 99% of the time, I do not have to take them off blood thinners. Majority of the time, I do not have to change any medications for a patient or do anything, because it is so minimally invasive.
Yeah.
We're not, taking away big amounts of bone, not making incisions. It's just a little bit of numbing and placing the implants.
Just admit it, Dr. Ackerman. You're impressed with my knowledge of your product.
I am. Oh.
I'm a student. I'm listening.
Yeah.
There's another aspect that I want to show, one more model, and that's if you have one or two teeth missing.
Yes.
Can you show the folks exactly how that works, Dr. Ackerman?
Yes, certainly. Yeah. So I know we're talking a lot about if you're missing all your teeth or a denture, but like you said, somebody might have had trauma, or for whatever reason have lost a front tooth, so we can definitely replace just one tooth. So this shows just the mini implant placed exactly the same way, no incisions, no stitches. Once we place that implant, you don't have to wait 3 to 6 months to get your tooth like the big surgical method. And then we have the nice pretty tooth made, and that gets cemented on to the implant. And it doesn't have to just be one tooth. Like you said, a lot of people are missing, what we call their chewers, their molars in the back, and they miss, chewing their food in the back. And we can do multiple teeth, so we'll place, multiple implants, and then have, like a little bridge of teeth made, and then that gets cemented on to these implants permanently, so it does not come in and out of your mouth. It is not like a partial or a flipper, and for those of you that have those, you know what I'm talking about, because they are miserable to wear. So these mini implants can get you out of that, and it's you know, I had a patient tell me it's like they grew their tooth back with these mini implants. So it can be one tooth, it can be 2 or 3 teeth, you know, and get you chewing again, or, you know, get you smiling again if you're missing a tooth in the front. So there's a multitude of ways we can do these mini implants.
Now, let's talk a little bit about being able to, once again, enjoy the foods that you love. If you have dentures and they're ill-fitting, or the glue, and you're afraid they're going to move or actually come out, then you're probably staying away from certain foods. You mentioned, I think, was it Audrey?
Yep.
Yeah, Audrey was pretzels. Pretzels, you said.
Pretzels.
Okay, I'm just curious, taking a poll here, what's the #1 food that most of your patients say they missed, and now, thanks to Freedom Mini Implants, Mini Dental Implants, they can enjoy? What's the #1?
I would honestly say steak.
Really?
Yep.
Chewy steak.
Yep, especially my men. They want steak. Yeah, they miss their steak.
Yeah.
I will say the women sometimes are more like salads and, you know, the vegetables.
Yeah, the
and
crispy
things like
vegetables.
That. Yep, but steak, and not far behind it is peanuts. So,
Really?
Yeah. We had a patient come in, and I thought it was so cool. He missed, and maybe it's a thing, I never did it, but was putting peanuts in a Coke. And it sounds actually good when you think about it.
I'll give it a shot.
Yeah, and so he was like, that's what I'm going to get. And actually, when we did it, we gave him a Coke and a jar of peanuts because he missed that and he couldn't do that, you know.
Well, so if it's steak, do you give him like a gift certificate to Jeff Ruby's? Do you do that, Jeff?
Yeah, we do, definitely.
I believe you do.
We honestly do, because, I mean, people have not been able to eat, and, you know, especially that juicy steak, and that is one of the #1 things. So we do. We give out gift cards a lot, and we say, go enjoy that first steak on us, for sure.
I love that.
Yeah.
Okay, so again, Freedom Mini Dental Implants. We have a little bit more information. Don't forget that consultation is absolutely free. We'll talk about that more next on Wait 3 Listens.